Hi, my name is Jasmine Pope, and I am going to explain how to change a tracheostomy dressing. So first thing you want to do is gather the supplies before going into the room. And that would consist of the sterile tracheostomy tray, normal saline, hydrogen peroxide, eye protection, the suction equipment, and I believe you also should have a oxygen bag handy. Next, I'd go into the room. I would then introduce myself. I would perform hand hygiene. I would have the patient state their name and date of birth. I would explain to them what I'm going to do, and I would make sure that the head of the bed is elevated, and I would make sure that I have oxygen within reach if needed at any time during the tracheostomy dressing change. So hands are washed, patients okay with the procedure. I would wash hands, put clean gloves on, and remove the dressing that's in place, and I would discard that. I would then remove those gloves, clean my hands again, and I would make sure to put on clean gloves, and I would loosen, before putting on my gloves, I would make sure that the peroxide and normal saline is open and ready to go. And then I would open up the sterile aspect of the tracheostomy kit. I would then don my sterile gloves. I would remove the drape with the plastic liner, and I would fill the tray up with the and I would set up the sterile field. I would arrange everything onto my sterile field. I would pour the saline and cleaning solution in 2 different containers. I would then remove the trach collar from the patient's neck. Excuse me. From there, I would make sure to pull out the inner cannula using like a 4x4 to stabilize the plate with my sterile dominant hand. And then I would start to put the cleaning solution. I would take the inner cannula and I would clean it with a brush and a pipe cleaner. There's different names and different ones used depending on the facility. I think a Shilly is one. Next, I would then immerse and rinse the inner cannula in the sterile saline or sterile water. I would replace the inner cannula and resume oxygen if it's ordered. I would make sure to clean the trachostoma site. I would make sure that I'm looking for any signs and symptoms of infection, drainage, redness, anything like that. I would make sure to clean it with the cotton-tipped applicator, and then a 4x4 gauze moistened in sterile saline. I would look for any evidence again of wound erosion or anything like that. I would then take a 4x4 with saline, clean the trach plate and the outer cannula, and then I would apply a dry dressing to the trach site. And then I would just make sure that the ties are all in place. They're not soiled. I would remove the old ties, making sure that the new ones are already secure and in place so that I can gently pull out the old and the new are already in place, and I can adapt them to the sides of the tracheostomy site. I would make sure I would tie them with the head flexed. I should be able to insert 1 finger underneath the tie in between the neck. They have to be secure so that the tracheostomy tubing is not moving or causing tracheal damage. And then from there, the trach ties are now in place. Depending on the facility, you can change them every 48 hours or as needed, because they can sometimes get soiled and things like that. I would make sure all of my equipment is discarded. I would wash my hands and document my procedure.